My name is Yana Churchizindu, and today I'm going to be talking about pressure sores, pressure ulcer.
Sorry, I'm excited.
And I'm going to be talking about the definition, the symptoms, and localization of pressure ulcers. Okay, pressure sores, also known as pressure ulcers or bed sores, are localized damage to the skin and underlying tissues that usually occur over a bony prominence as a result of usually long-term pressure or pressure in combination with shear or friction, as when the bone is cycling on the skin. So when you talk about the localization of pressure sores, talk about the head, ear, shoulder, elbow, your hip, inner and outer thigh, your knee and your heel. I also talk about your buttocks. Talking about the symptoms of pressure sores, you have change in skin color or texture. The skin of the color of the back part of the skin changes. You might have swelling, you might have pulse like draining, like discharge, a liquid discharge from the area. The area might feel different from other parts, maybe cooler or warmer than other areas, and it also feels tender to touch. When you touch, it feels tender. Thank you.
I'm Richard Tetefoli, and today I'll be demonstrating how to check on bed sores on the patient. So when the patient is lying in a supine position, we check for bed sores on the head, the shoulders, the sacrum region, and the legs, especially this part. And when the patient is lying on a lateral position, so you check for bed sores around the ears, the shoulders again, the sacral region, the outer and inner thigh since they rub against each other, the legs, and you're done. So talking about bed sores, there are 4 stages of bed sores. The first 2 stages are reversible, where the first stage there's a red patch that forms due to the pressure on the tissues. The second stage where a sore forms on the epidermis of the skin. The third stage is where the wound gets deeper and passes through the dermis of the skin, and the fourth stage where the wound goes all the way to the bone. Okay, so we're going to be demonstrating the first stage of bed pressure sores. So holding the wrist for about a minute, applying some pressure to it, there's going to be a red patch on it. So looking at the arm right now, you see a red patch around this spot. This is the first stage. Okay, so looking at the screen, you see the second stage, the third stage, and the fourth stage of pressure ulcer.